with all due respect to the Citizens Budget Commission, this is not I think from their point of view, maybe they think this is a wonderful moment for budget cutting. That's not how I see it. This is a moment to try and protect our people, protect their safety and health, make sure they have enough food to eat, make sure they have a roof over their head. And whatever that costs is what we need to do. And then work our way back to the city that just months ago was succeeding across the board in terms of having a thriving economy and the lowest unemployment we've seen in a long, long time. And, the things you would want for this city, we want to get back to that. And the formula was working. We want to get back to that formula. So I would argue, we were on to something very good. We want to work our way back to it. But no, we're not for a moment. We're not assuming any state aid. In fact, the state cut us $800 million, and we have to guard against future state cuts. So I think we're being very realistic about that. I think if there is not federal aid, you're going to see many tougher decisions that are really going to hold us back and undermine our ability to provide even the most basic services.
Next, we have Mark Morales from CNN.
Hi, everyone. How you doing this morning?
Hey, Mark.
So I had a couple of questions. The first was about a report that happened over the weekend about folks that have left.
Hey, Mark, you're coming in and out. Let me interrupt you, Mark. You're coming in and out a little bit. Can you get closer to the microphone and speak a little more steadily?
Sure. Is this any better?
Yeah, let's try.
Cool. So the first was about inmates at Rikers Island that have left the jail system and have gone out, committed crimes, and are back in the jail system now. Can you speak a little bit about that, and what have you seen? The second question I had was about testing.
Go ahead, say it.
You mentioned on Friday that you were going to be opening up new testing centers, and I just wanted to know, how did that work out? Who was tested? Do you have any data on that?
Okay, thank you, Mark. On the second question, we'll get the data and start to put out that data as we confirm it. Some of the centers were opened Friday, some are opening today, and we gave the projections on what they'd be able to do each week, but I again said I want to see those numbers go up rapidly. So we'll get a report out later today on how Friday went and on how today is going and what the numbers look like. On the folks who have come out of Rikers, look, when this crisis began, the issue was how could we address the humanitarian crisis in our jails appropriately, let out people who could be let out safely, deal with the fact that there were individuals with profound, major health problems who have been particularly vulnerable to this disease, but also always keep public safety in mind. And obviously, by getting people out of the jail system, it was going to allow a safer environment for everyone who was still in, including very much the folks who work there, and we depend on so much our officers. And that has proceeded to happen. About 1,400 people have been released, and that has certainly improved the overall situation in our jail system. But we said there would be, a rigorous monitoring effort as well, and that has been built up. We do see some recidivism. I don't have the exact numbers. We see some. I've not seen a huge amount, but any amount is obviously troubling. And I think it's unconscionable just on a human level that folks were shown mercy, and this is what some of them have done. But, it's a small number of people. We're going to keep, just buckling down on it, making sure there's close monitoring and supervision to the maximum extent possible. And the NYPD is going to keep doing what they're doing. They've obviously been driving down crime these last few months, and they're going to keep doing that. But if anyone commits the kind of crime they have to be rearrested, of course they will be. If they have to be reincarcerated, they will be. But I think, against the of what was a real humanitarian crisis, it was the right approach. Now we're gonna deal with everything going forward.
Next, we have Sydney from the Staten Island Advance.
Hey, Mr. Mayor, good morning. I have two questions, if I may, about the medical personnel you announced yesterday and the 311 number. So first, can you explain what exactly the difference is between the 600 medical personnel and volunteers and 535 medical military staff. Are medical personnel more nurses and technicians, and our military medical staff specifically more like doctors and nurses? And why didn't you send any of the medical military staff to Staten Island hospitals? And my second question is, yesterday I tried out the 311 social distance enforcement number, and I received an error message saying the tech service was unavailable. Your office was quick to fix the problem, and I resent the photo, and it seems to be working. I got a text message saying that a representative would be with me shortly, but I never heard back. Can you explain how exactly the tech service is supposed to be working? Is someone supposed to get in touch with you after you send the text? And why was the tech service not working, at least, yesterday?
Yeah, there was an issue yesterday. It has been resolved. So the basic concept is this: if you call in, as I said the other day, on anything COVID related, particularly food, we want people to have instant ability to talk to a human being and register their need and get it acted on. On the calls related to violations of social distancing, that's also obviously urgent. We need people to be able to get that to a human being right away and then get it out to where it can be dispatched by NYPD. So I appreciate, again, I'll keep saying thank you to you and everyone in the media who's doing this quality control, because I think it helps us to keep monitoring. Obviously, the city does its own quality control, but anytime you find a gap in the system, that's helpful because we want to fix it. In terms of the calls, that's how it has been working and should work. And again, many additional personnel have been added in the last few days to beef it up. In terms of the photos, I know, I've spoken to Commissioner Shea about this, that the photos are being monitored constantly by the NYPD for action. In terms of whether there's a response back to the person who sends the photo, I don't know that, but we will get you an answer on that today. On the question of the military personnel and the volunteer medical personnel, so the military are a variety of specialists. They're doctors, nurses, respiratory therapists, dietitians, pharmacists. They're a whole range of specialists, primarily doctors and nurses. The original request was for our public hospitals that unquestionably were bearing the brunt. Elmhurst, Bellevue, Lincoln, so many others, and that's where they've gone, and they've been absolutely outstanding. The personnel coming in through the Medical Volunteer Corps, which is a city function created by our Department of Health, are folks who bring a wide variety of medical skills. They are being distributed out to independent hospitals that need help, and to, including obviously thinking about hospitals on Staten Island, that any hospitals, whether they're part of a bigger system or they're independent, but the ones that need help the most, we have found, are the independents, and to nursing homes that need help. And that system, again, a wide variety of healthcare professionals, we're applying that wherever the need is greatest. But I think the simple point here is, which we've talked about before, Sydney, and I know you're advocating for Staten Island, I appreciate it. The hospitals that bore the brunt of this overwhelmingly were those public hospitals. That's where we sent the help from the military. Obviously, I'd like to see a lot more help come in, and then we could expand it more broadly. But we have been able to get that medical volunteer group, which is a lot of the same exact medical professionals in terms of training, out to a broader swath of the city and our healthcare institutions, our nursing homes. And we're going to keep making adjustments as the need is clear. I think that's the central point. And again, I appreciate the advocacy, but it's really going to come down to us as where are the gaps that we need to fill? And we will move people according to the gaps. Whenever we see a situation where, some place just doesn't have enough personnel and another place has more than they need, we're going to move them around accordingly to address that need.
Next, we have Gloria from New York 1.
Gloria?
Can you hear me?
Yep. Can you hear us?
Thank you. Oh, yes, I got you.
Go ahead.
I wanted to follow up on a report that we got this weekend about 3 men who were discharged COVID-19 patients, and they were sent to the Hilton Garden Inn in order to isolate from their families. The 3 of them have passed away. I wanted to see if you had an update on that specific situation, and if there's anything you could tell us about why these men were discharged, and how is the city monitoring this, and what happened here?
So we are doing a review right now to understand what happened. My understanding very initially, and it's obviously tragic. I mean, as I understand it, Gloria, these are 3 people who were in hospitals for COVID-19, got care, recovered, and were released. And my understanding is one was from Montefiore in the Bronx, one was from Maimonides in Brooklyn, one was from Harlem Hospital. And then all 3 have passed away, and we're doing a full review right now to understand what happened. If they were all discharged and all from different hospitals, something doesn't make sense here. And why have they lost their lives? So we're doing a full review to understand that. We're also going to, out of abundance of caution, add additional medical personnel and other personnel to do more checking in with people, even if they've been discharged. You'd think if someone has been discharged from the hospital, it's an all clear, and the reason they're in a hotel is simply transitional, particularly if they happen to have a family situation that's not conducive to go back to or something like that. But we're going to add additional personnel to ensure that everyone is being very closely watched and supported. But we don't know yet what happened here and why it happened, and when we do, we'll certainly let you know.
Next, we have Bridget from WNYC.
Thanks, Mr. Mayor. First, I just want to follow up. I have 2 questions, but I want to follow up on Gloria's. Just to clarify, the hotel where those 3 individuals were staying, was an isolation hotel. So I'm curious if the city is planning to increase any screening for the other guests who are still there beyond just a wellness check. And then my second question relates to the governor's announcement over the weekend about statewide antibody testing. I'm wondering what your thoughts are on the plan and how the city fits into it.
Yes, on the first point, yes. I tried to say, I'll say it better, that we absolutely to check on people more deeply in that facility, because we want to know, that hotel, we want to know exactly what's going on, and we're confused how this could have happened. And again, don't know if there's a connection between the 3 deaths or not. We just don't know enough yet to give you a definitive answer. But we'll be beefing up the amount of personnel devoted to consistently working with people who are staying in those hotels. Want to make sure we're constantly checking on them, and if people need something, that it's evident real quickly and acted on. On the antibody tests, again, this is an area I think we can say where there's some real